it's Dr. Denney over at Four Paws at Fulshear Veterinary Clinic, and today Maddie and I are going to be chatting a little bit about older kitty cats. That's right, senior cat care.
Dr. Denney, how will getting older impact the health of my cat?
So just like as humans get older, we can see a lot of changes, so can cats. So I believe the studies that were published is something around, over 50% of cats at the age of 10 have some degree of arthritis. So looking out for symptoms of arthritis is going to be really important. Cats can also get different organ dysfunction diseases like kidney disease, liver disease. We can see pancreatitis, diabetes. There's all kinds of things that really we can check for as long as we're seeing them once a year, that we can screen for these diseases and help treat them and let your older kitty cat live longer.
How do a cat's nutritional needs change as they age?
So that's a really great question. Cats are obligate carnivores, and as such we need to make sure that they are getting a very high protein, low carb diet. As they age, we can see loss of muscle mass, so really making sure that you're on a senior cat food is going to be good, because it's going to have a little bit of higher value of protein in the senior food. The other thing I would recommend is adding in wet food as they get older. That wet food not only has water content, but we can also see some improved protein absorption.
What are some signs and symptoms that your cat may be slowing down?
So a big one is sleeping more than normal. So we all know that cats are going to sleep a little more as they get older. They love to sleep. I'm going to turn the music down just a little bit. We were jamming while we were filming these videos. So sleeping just a little bit more. I know that our cats sleep a lot during the day. They are nocturnal, so that is some normalcy. But if you have a cat that usually plays with its housemate and you're noticing that, oh, maybe we're not playing as much anymore, or maybe we're being a little more hesitant to jump on and off furniture, or going downstairs. Are we taking them 1 foot at a stair, or are we kind of bunny hopping? Those are signs of arthritis. I know with my older kitty cat, when he's jumping down from something now, he goes from my counter to the chair to the floor in the bathroom. And that was one sign for me that told me that his arthritis was acting up. So things like that are going to be what you can start to watch out for. Any change in urination or water intake. So drinking more and urinating more can be, meaning that maybe we're getting diabetes, or maybe our kidneys are starting to have problems. Be monitoring the pee clumps in the litter box. A normal pee clump should be, about yay big. If we start to get these massive pee clumps, then we need to get the cat in to go ahead and see what's going on. Urinating or defecating outside the litter box. Sometimes if their hips are hurting, or if it hurts to hold that posture when they're making a bowel movement, then sometimes they'll go outside of the box, because they'll have, I call them the walking poops. So just things to keep an eye out for.
What kinds of preventative care can help extend the life and health of my cat?
So I'm a big believer in preventative medicine. So I think that any cat over the age of 7 or younger, honestly, getting lab work done once a year is going to be really important. We have a chance to catch diseases before they're symptomatic. So if we catch kidney disease, we have a chance to change their diet. We have a chance to, help put them on medications that might help them, probiotics that help with the kidney values and the kidney enzymes that can get built up in the bloodstream. So preventative medicine is going to be super important.
What is the most important thing to know about caring for a senior cat?
I think just quality of life, making sure that they're comfortable, making sure that they're eating and drinking, monitoring if their food intake is increasing or decreasing. Are they losing weight? Are they losing muscle mass? Often with my older kitty cat, if I look at his thighs now, if I took a picture of him now versus 5 years ago, he had a lot more muscle mass on his legs, and for me that's a sign of arthritis. So being cognizant of weight loss in your cats, because when you see them every day, we don't always notice it. So paying attention if a family member comes over and says, oh, Fluffy's a lot skinnier than he used to be. Pay attention to those comments, and go ahead and get your cat in at least once a year, if not twice a year, so we can keep an eye on things and help Fluffy live a little bit longer.